Welcome to R.K Medicos. In this section, we are going to discuss about the third part of our autonomic nervous system. And what we are going to discuss in the third part of autonomic nervous system is basically they are the Cholinoblockers drug. And in previous section, part 2, we are already finished about the cholinergic agonist drug, or we can select the cholinomimetic drugs or the parasympathomimetic drugs. We also discuss in two parts. There is a direct and indirect acting. The direct acting we discuss about the cholinomimetics or the cholinergic agonist, and indirect they are also discussing about the cholinesterase drugs or the anticholinesterase drug. Now we are going to see here in the third part how the action what done by the cholinomimetic drugs are gets blocked, or we are going to see they can be reduced by the some drugs. That one is called as anticholinergic drugs. They are decreasing the parasympathomimetic effect on that drugs and on the receptors and on the different types of activities in the different parts of our body. The parasympathetic action is basically regulated in the several parts of our body, but the sympathetic is most of the part they are regulated. So in this section we are going to see anticholinergic drugs. The cholinoblocker, these names are anticholinergic. It means they blocking the somehow cholinergic receptors, that is acetylcholine. And the same name we can also say they are also called as cholinomimetics. So their name is cholinoblockers. They are going to mimicry means mimetics. They are going to blocking of that mimicry activities. So they are classified into two parts: cholinomimetic muscarinic blocker and the nicotinic blocker, because there are two types of receptors in the parasympathetic. And you know now the muscarinic and nicotinic. Muscarinic are different types, that is M1, M2, M3, M4, M5, and the M1 is located somewhere in the central nervous system and also in the GIT several regions. M2, M3, M4, M5, like this. These all receptors location you know now adds from the first part. And in the second part we can see the nicotinic blockers. They are basically they are going to block nicotinic muscular receptors or the nicotinic neuronal activities. They both are get suppressed or the inhibited by them, or the activity will be suppressed. So we are going to see first anticholinergic drugs or the cholinoblockers, in which the nicotinic blockers they're going to block the nicotinic receptors on the parasympathetic activities. These nicotinic receptors are blocked by in the two ways, basically nicotinic neuronal, where the ganglions are present in the autonomic nervous system, or the sympathetic or parasympathetic. Basically what we are going to discuss here only parasympathetic. It means all the parasympathetic nicotinic neuronal will be gets blocked. And these receptors these drugs, what the drugs are going to block them, they are called as ganglionic blockers. Because I already told you, suppose that this is our spinal cord. From there one neuron is begins and they reaches here, and from here a neuron is going to the effector part of our body, and this region is called as ganglion. And you know now in ganglion all the receptors are nicotinic neuronal receptors. That's why these are called as ganglion, and we are going to now block these ganglions. So these drugs are called as ganglionic blocker. So what are the ganglionic blocker drugs? Suppose that what is it, a spinal cord. So we are going to discuss here how the drugs blocking the ganglionic activities, or the ganglions gets blocked by these drugs. That's why they are called as ganglionic blockers. Next one we can see here, that is the A.N.S blockers, that is nicotinic muscular blocker or the neuromuscular blocker. They are going to, when the skeletal muscle, suppose that here we can say like this, there is a one part of neuron and this is the muscles. We can say on the muscles there is somehow these receptors are going to be blocked. Suppose that these receptors are going to be blocked. It means what? There is no any activities occurs in the muscles. So these muscles are gets in relaxation state. There is no further contraction of these muscles. There is a contraction is totally absent in muscles, because these receptors are going to be blocked. By what? By the neuromuscular blocker drugs. So we are going to see what are the neuromuscular blocker drugs. Do you know here? There are the two types of drugs on the basis of their nature of depolarizing. They may be depolarizing or may be non-depolarizing. The drugs are depolarizing in nature are only one. We can see here succinylmethonium chloride or succinylmethonium iodide. This is the drug which is depolarizing in nature. This is also a drug which going to relax the skeletal muscles, or they are working on the skeletal muscles. So these drugs are called as skeletal muscle relaxant. They are depolarizing. One is the non-depolarizing drug, that is tubocurare or the curare. Tuberculosis is the drug which is the non-depolarizing, and they are basically used in our general surgery or the surgical operation. So curare is used in it. And now we are going to see about the some ganglionic blockers. What are the ganglionic blockers? They are going to block the ganglions of the pre-ganglionic activities and the post-ganglionic activity. Between them the ganglions are present, or we can say like this: pre-ganglionic fibers and post-ganglionic fibers, in between them ganglions are present, and these ganglions are going to be blocked by the several drugs. That drugs are called as ganglionic blockers. Simple. And what are the mechanism of this blocking of the ganglions? Suppose that these ganglions are going to be blocked in the sympathetic nervous system, and now you know in sympathetic nervous system post-ganglionic fibers or the post-ganglionic neurons are secreting norepinephrine. It means is a blocking of norepinephrine release. There is a blocking of what? Norepinephrine release will be blocked. Why? Because they are present in post-ganglionic segment. In pre-ganglionic segment, all the nerve fibers, either sympathetic or either parasympathetic, all the receptors are nicotinic neuronal receptors. They are releasing acetylcholine. It's simple. In next session we are going to see about the post-ganglionic neurons in the sympathetic nervous system. They release norepinephrine always. They are not going to release acetylcholine. So this norepinephrine going to be blocked. They are not going to secrete, and this norepinephrine will leads to decrease in blood pressure of the patient. Where we are going to do the any patient blood pressure is higher, it's going to decrease the blood pressure of that patient. So it's so simple. When we are going to block the ganglionic muscular, so these drugs will be used where? In hypertensive drugs. Yeah, when the patient feeling hypertension condition, so we are going to take the ganglionic blockers. They are going to block these receptors. We can see next one. These are used in not a first line treatment of the hypertension. They are used in the second line management or the treatment of hypertension. When the patient is having high blood pressure, it will be reduced by the ganglionic blocker drugs also. And we are going to discuss everything about the anti-hypertensive drug, in which there is a several classification is happening. That is first class, second class, third class, like this. So this drug, the ganglionic blocker drugs, are included inside the second class of the drug. We discuss later everything. What is the side effect of these ganglionic blocker drugs? That is postural hypotension is the side effect of these drugs. So these drugs are not preferably used. The preferably used is first line of drugs. And what is first line of drugs? We discuss in the anti-hypertensive section. So next point we can see here, what are the other name of drugs which are included inside the, till now we just study about the ganglionic blockers, how the action is performed. Now we are going to see several drugs about them. What are the name of that drug is first one, tetraethylammonium is a ganglionic blockers. Next one is mecamylamine. These are also ganglionic blockers. Next one is trimethophan is also ganglionic blockers, or the hexamethonium is also ganglionic blockers. So these all are the drugs. These all are the four drugs are ganglionic blockers. And what are the suxamethonium drugs? Suxamethonium we can see here. Suxamethonium is a neuromuscular blockers. So hexamethonium is ganglionic blockers. Now we are going to see trimethophan is used only in the intravenous route if the patient is having any hypertensive crisis or the hypertensive emergency. So the hypertensive emergency in the patient, we are giving what drugs? Trimethophan. Next point we can see triethyl or the tetraethylammonium. They are the not clinically used these days. They are basically used for the experimental purpose or the research purpose. So these drugs are only for the research purposes. That is tetraethylammonium. Next one is mecamylamine. These are also used in the second line treatment of hypertension. What is another drug that is used in the second line treatment of the hypertension? We can see here. That is the ganglionic blockers, because these drugs are having lesser side effect or more side effect. There is a severe side effect, that is postural hypotension is done by these drugs. And these drugs we can see are, what are the mecamylamine, how they can be applied on our body. These drugs are present in the nicotinic pouch or the nicotine pouch, and they are also used in the smoke dependence patient. The patient is smoke dependent, we can also use these drugs. And next point we are going to see about the muscarinic blockers. These are all about the nicotinic blockers. What we discuss about that, there are two types, nicotinic neuronal, nicotinic muscular. Nicotinic neuronal is having two drugs, we are basically depolarizing, non-depolarizing. And in the nicotinic ganglionic blockers, they are going to decrease the norepinephrine, so decreasing the blood pressure, second line of drug of hypertension. We everything discuss here. In next point we are going to see about the muscarinic receptor blockers. What we are going to discuss in the muscarinic receptor blockers, they are also called as anti-muscarinic blockers. Why they are called as anti-muscarinic or the anti-muscarinic drugs? Because they are going to block the muscarinic receptors only, M1, M2, M3, M4, 5. These all the receptors are going to be blocked by these drugs, or their effect will be decreased. We can see, and here we are going to see each and every region of our body from top to bottom. We are moving from top. Suppose that in the central nervous system M1 receptor is present, then how these drugs or the anti-muscarinic drugs are acting in the central nervous system and decreasing or increasing the effect, we are going to see here. So basically it is decreasing the activity everywhere, and where it is not decreasing, in the heart it increasing the heartbeat, because in parasympathetic activity, you know from that they are agonist drug, or the agonist activity does decreasing. It means the anticholinergic drug or the anti-muscarinic drug is going to be increasing the heart rate, because all the M2 receptors, or we can say like this, all the receptors are present in the SA node and AV node on the heart, so their activity will be increased. We see later. For now we are going to see central nervous system. We discuss everything, anti-muscarinic receptor, where they are located in our body. We are going to see from top to bottom. First is central nervous system. In the central nervous system, you know, from the receptor part, there is a M1 receptor is located, and it is responsible for the decrease in cognition or increase in cognition. Basically it increasing the cognition activity in our central nervous system. So what is the effect of the anti-muscarinic drug? After the taking of anti-muscarinic drug in the central nervous system, they are going to decrease the cognition or increase the cognition. Of course it's going to decrease the cognition, because these are blockers. So these drugs are going to decrease the cognition activity. After the taking anti-muscarinic drug, their effect will be decreasing the cognition. Next point, what is the drug is the acting on central nervous system, they're decreasing the cognition. That is escapolamine. Escapolamine is the drug used in narco analysis. We can say like the narco test. We listen many days in our news or the newspaper, everywhere we can see the narco test is happening for someone in the criminal investigation or the many purposes in the CID investigation. So we can see here narco test is done by the something. That drug is called as escapolamine previously, but for now we are going to use here thiopentone. Thiopentone is basically the anesthetic drug. This anesthetic agent is also used in the narco test or the narco analysis, we can also say like that. And this serum, what the serum we used in the narcolepsy test, narco analysis or the narco test, they are called as truth serum. These serums are called as what? Truth serum. And they are acting as the patient. They are basically used for the criminals who are hiding the many things from the police or the we can say like this, from the court. So we are going to test the narco for them, and we use basically scopolamine in these cases. So the patient are going to say their feelings about what they know about it, or the different types of the information we are going to check it. So we can see a next point. In the pupils, first we discuss in the brain or the central nervous system. Now we are going to on the pupil. What is the drug reaction on the pupil is anti-muscarinic. Their effect is anti-muscarinic. Basically they acting on the M3 receptors which are present in our eyes. They are doing mydriasis, because in the parasympathetic activity, the increasing the effect or the contraction, they are called as basically what? Contraction of the iris. That time is called as meiosis. So we are going to blocking them. So then what happened? There is a dilation of the pupil. What happened in the parasympathetic agonist drug, or the we can say like this, cholinomimetic drugs, cholinergic drugs, they are muscarinic cholinergic drugs, they are increasing. It means their contraction will be increased. But here we are taking anti-muscarinic drug. It means they gets dilation of the eyes, and the dilation is term used for them, that is called as mydriasis. Once again we can see cycloplegic drugs. They are used for the paralysis of ciliary muscles of the iris basically, or the eye, and they going to patient feel several, say like this, they feel somehow good in their life. How they feel good, we can see here. The usage of these drugs, when the cycloplegic drugs or the mydriatic agents will be used in the pupils, and they are acting on the M3 receptors. When the patient is mydriatics or cycloplegics are used, suppose that we want to check the fundus examination, or we want to check the fundus of the eye. So we are going to give the patient mydriatic agent. The patient eye will be gets dilated for the several time, and we are able to identify or examine the fundus. Next point, we prevent the synaptic formation. What the synaptic formation is basically, if any patient is suffer from the uveitis or the corneal ulcer disease, their front part of it in the pupils, we can say like this, they are get snaky formations. It will be like a contracted. So after taking the mediatic drugs, they are gets dilated, and when they contracted again for after some time, it will leads to the snaky formation and the blocking of them. So it will be reduces by the action, or the dilation is done by the mediatic agents basically in the patients. Next point, we can see what are the cycloplegic drugs action. They are going to paralyze the accommodation muscle. What the muscle are providing accommodation in our eyes, they are gets paralyzed by these drugs. Or for the several good effects we are doing this. So if the patient is having iridocyclitis, it is basically the inflammation of the iris and ciliary bodies. If any patient is having inflammation in the iris or ciliary bodies, so we are going to is having the severe pain in that patient. So we are going to reduce the pain, and the reduce the pain is how happened. You can imagine when the muscle is gets contracted more, ciliary muscles, it will be feel more pain because these there is having inflammation in that area. So we are going to reduce the pain by the taking paralysis, or by doing the paralysis of that muscles what are going to be contracted. So these muscles are get paralyzed by the cycloplegic agents for the several times. And there is also in the several tests we using these drugs, that is refractive error test. With the patient is having any refractive error, so we are going to identify by the checking. Cycloplegic drugs will be given to that patient and going to check about the refractive error test. Next point, we can see what are the anticholinergic drugs we are used here as a mydriatic agent or the cycloplegic agents. What are the name of these drugs? Basically they are used as a cycloplegic and mydriatic agent. First point, we can see the anticholinergic drugs will be the tropicamide or the tropicamide. Next one is atropine and the homatropine or the cyclopentolate. These are the four drugs we are going to use as a mydriatic agent or the cycloplegic agent. What are their effect? Now you know, they fundus examination or the somehow they are preventing snaky formation. So first drug, tropicamide. When we use the tropicamide drug, basically if the patient is having, these drugs are prevent basically in the adults and they are shortest acting, so we have to use many times for in a day. And atropine is a most potent anticholinergic drugs. They are also used in basically in the children for the mydriatic purpose or the cycloplegic purpose, and they are also in the case of fungal corneal ulcer, and they preventing the snaky formation, once again the collapsing of that area. Or the preferred drugs in the case of iridocyclitis, atropine is given in the if the patient is have suffer from the iris and ciliary body inflammation. Basically these drugs are preferred. Which drugs? Atropine, because these drugs are most potent, their action will be very potent or the strong, so we can take these drugs in the case of iridocyclitis also. Next point, we are going to see homatropine and cyclopentolate. These are the another two drugs, they belonging to the mydriatics and cycloplegic drugs. Now we are going to see here, first we discuss central nervous system, then pupil. Now we are going to see in the oropharyngeal region or the secretions of it, and in the lungs region, what happen in the lungs, pharynx, or we can say like the oral region or the secretions. First we are going to see about the oropharyngeal secretion. If the any patient is having what is the main function of parasympathetic in our body, in the oral or pharynx region, they are going to produce more secretory gland. They promotes the secretory glands to secretion is increased. This secretion increased by the oral or pharynx gland each gets, we have to reduce it because we are taking anticholinergic drugs now. So there is a hypersalivation. We can select this hypersalivation. The patient is having hypersalivatory glands. There is a drooping of the saliva from mouth to outside. So these drugs, these are the drugs which are going to preventing the hypersalivation, or we can say like this, oropharyngeal secretion increase will be decreased by these drugs. So these drugs, after the taking these drugs, they are going to reduce the oropharyngeal secretion. And what is the usage of these drugs? When we are going to use? Basically in the patient, we are going to give the pre-anesthetic medication. Anesthesia will be given, then we are giving previously, before we giving the anesthesia or the anesthetic agents, and they prefer to because these drugs are do not crossing the blood-brain barrier, because these drugs are quaternary amines, and any drug is quaternary amine, it means these drugs are lipid insoluble. If the any drug is quaternary amines, it means they are the lipid insoluble. It means these drugs are not going to transfer inside our central nervous system. So they are not going to produce any central effect in our body. So these drugs are good for the health also. So we taking these drugs. And what is it? Glycopyrrolate is the drug used here. In next section, we are going to see action on the lungs. What are the anti-muscarinic drug action on the lungs? You know from the initial, in parasympathetic action, the lung activity, it means the bronchial glands, and what are the glands which are present inside the lungs or the bronchi will be, they gets constricted in the parasympathetic, but we are going to block their anti-muscarinic action. So there is a constriction, it gets dilated. In first part, there is a bronchodilation after the taking anti-muscarinic drug. In the what is the usage of these drugs? When we are going to use these drugs, if the any patient is in COPD, that is chronic obstructive pulmonary disease, there is several group of diseases are included inside it. So if there is any disease is related with COPD, what happen in these patients, there is a inflammation is happened inside the lungs, their bronchi and the bronchioles, and after some time it gets fibrosized or sclerosed. Sclerosed or fibrosized means what? This, suppose that this is the lumen of the bronchi or the trachea, inside it there is a fibrosis is occur. It means after that they are not going to further dilation. It means in this case, in this patient, if the parasympathetic activity is increased, it means they are gets more constricted. It means there is no any further dilation is it. So we are going to take only which drugs? Anti-muscarinic drugs. They are going to acting on it and they dilate this up to the sclerosing area, or we can select the fibrous area. So we can see these are the drugs is irritating the parasympathetic nervous system only, not going to sympathetic system, and in the bronchi of the in the COPD cases, and they activating the parasympathomimetic effect. How they are going to parasympathomimetic effect? What is happening here? If the any patient is having parasympathomimetic drug will be taken, it leads to the more constriction of these vessels, and there is a reversal is happened. If the drug is taken, which drug? Anti-muscarinic drug, there is a vasoconstriction will be, bronchoconstriction is gets dilated into the vasodilation, and these anticholinergic drugs, that's why they are drug of choice in the COPD. There is a not sympathetic drug, sympathetic and sympathomimetic drugs will be given to these patients. Why? We'll discuss that time also, but for now we have to memorize this, and they are also used in the bronchial asthma cases. So now this is the action of these drugs on the lungs. Now we are going to see what are the name of that drugs which are acting on the COPD or the bronchial asthma cases. What are the name of that drugs? What are the anti-muscarinic drug which are acting on the which are acting on the lungs and the COPD cases and the patient in bronchial asthma cases? That is, the first one is Ipratropium. Ipratropium is the drug. They are the short acting drug. They are uses 4 times a day because they are the short acting. The lifespan is very short, so we have to take 4 times a day. Next one is Oxytropium or Aclidinum. They are the 2 drugs. They are each having intermediate action or the intermediate lifespan. We can say like this: their half-life will be intermediate or the action will be intermediate, so they are taking 2 times a day. And next, Umeslitinum, Tiotropium or the Rivifenacin. These are the 3 drugs. They are the most important here because their action will be long lasting. Their action will be long lasting means when we take once a day, it will be helpful in, we are not going to repeat these drugs because we take once a day, it will be more potent to manage whole day. So we have to take only once a day. So these are the drugs. We are not going to use 4 times, 3 times, 2 times. They have to use only 1 times, and we can work for the where we are living. So these drugs are drug of choice because, and most important is a Tiotropium. Tiotropium is a drug of choice in the case of any COPD or the bronchial asthma. These drugs will be taken because their action will be longer or their long lasting action we take once a day. So these are the several drugs listed here. These all are the drugs included. Anticholinergic drugs will be action into the bronchial asthma and COPD. Now we are going to see several recent updates about them. We can see here the Rivifenacin is, we can say like this, they are the drug of choice in the COPD or the chronic obstructive pulmonary disease. These drugs will be most effective, or we can say like this, they are the drug of choice. When we are going to give drug of choice means simple, these drugs are specific for them and they are the more useful for them, more effective for them. There is less side effect for them. So these are the long acting. Rivifenacin, we can say also like this, yeah, that is Rivifenacin. These are especially Tiotropium is used in the also in the long acting or the long lasting effect. So Tiotropium and Rivifenacin, they are the 2 drugs used in the COPD. What are the side effects of these anti-muscarinic or the anticholinergic drugs in we can say like this, where in the lungs or the different regions of our body? Their side effect will be first dry mouth, that is xerostomia. It is the most common side effect of the anticholinergic drugs. Next point is glaucoma. If the patient suffer from the maybe glaucoma, it will lead, or the urine retention in our bladder. These are the three main side effects of the any anti-muscarinic drugs in the body. In next point, we are going to see anticholinergic actions on our heart. And on our heart, I already told you, in the parasympathetic activity, they are going to decrease, they are going to reduce everything. So in the anti-muscarinic drug, they are going to increase everything. What is decreases by the parasympathomimetic drugs or the cholinergic agonist drugs, we are going to decrease here by the anticholinergic drugs. So what are the action of these drugs? After the taking anti-muscarinic drug, these drugs effect will be on the SA node and AV node mainly. The receptors are present mainly on the SA node and AV node. So these drugs are going to increase the activity of SA node and the heart rate will be increased. What the heart rate will be decreased in parasympathomimetic drugs will be increased here. In the AV node, they are going to also increase the conduction of the AV conduction will be also increased. So in both the cases, we can say there is an increasing of heart rate. So it is the important function of the anticholinergic drugs. If any patient is suffer from the bradycardia or the bradyarrhythmia, so we can give these drugs, that is the anti-muscarinic drugs. We can see here. Next point, we are going to discuss about them. What are the name of that drugs and how you can use these drugs? The first one drug is atropine. Atropine is anti-muscarinic drugs. So these are going to also blocking these receptors, and they are used as an anti-arrhythmic drug. If any patient suffer from the arrhythmia or the bradyarrhythmia, basically they are going to reduce in the parasympathetic activity. It means we are going to anti-muscarinic drug given to that patient. It leads to increase the heart rate in the bradyarrhythmia patient. So we can use these drugs in the bradyarrhythmia patients, or also if the patient is having AV nodal block. If there is, suppose that this is the heart here, in the heart there is the, here is the atrioventricular, or we can say like this, interventricular suppression region, and here is the AV node is situated. This AV node gets blocked. If this AV node gets blocked, we are going to use these drugs and they helpful in the reversal. Suppose that the removal of this and leads to the AV nodal functioning little bit. So they are also participate in the reversal of AV nodal blocking. So they are the two main effect of these atropine drugs. They are useful into the antiarrhythmic drugs. We discuss everything in the antiarrhythmia in the cardiovascular system. Once again, for now you have to memorize, these are belonging to the antiarrhythmic drug groups, and they are used in the case of the patient suffer from the bradyarrhythmia. Arrhythmia means simply their heart rate will be less than 60 beats per minute, basically. So we have to memorize it. Now, what is effect on the GIT? We are going to see their effect on the GIT, on our gastrointestinal tract. Their effect, we first of all in the parasympathetic, what is doing? Their effect will be everything constricted, their stimulation, contraction and secretion. All the diastolic glands will be secreted. But for now, in this region, we can see after taking anti-muscarinic drug, they are going to action performing on the stomach, GIT and the uterus. We are going to see action on the three regions of our body simultaneously. The first, stomach, second, GIT and third, uterus. First, what is the mechanism of these drugs? First, you know now, in parasympathetic action, everything is stimulated, contracted and then secreted. It means what is happening in the stomach. First, we are going to discuss the stomach. They just stimulated, contracted and secreted. It means what is secreted inside the stomach. That is HCl. HCl production will be increased in parasympathomimetic drugs or the cholinergic agonist drugs. But we taking here anticholinergic drugs. They are going to reduce the HCl production will be reduced. First point. It means these drugs are, when their higher concentration leads to a developing a disease. That one is peptic ulcer disease. So we use these drugs in the treatment of peptic ulcer disease basically. And what are the drugs which we are going to use in the peptic ulcer disease? The first one is Parenzopine or the Telangiopine. Parenzopine or the Telangiopine, these are the two drugs which are acting on the M1 receptor. So they are the M1 antagonist drugs. They blocking the receptors in the stomach region and they decreasing the secretion of HCl. In next part, we are going to see about the mechanism. Once again, in GIT, they are more constricted, they are more secretion, so their contraction will be decreases here. Same in the uterus, their contraction will be increases in the parasympathetic activity. It will be also reduced or the decreased. So their contraction will be decreased. That's why these drugs are called as anti-spasmodic. Antispasmodic means simple, the spasm will be gets reduced. So the spasm will be reduced when there is a anticholinergic drug anticholinergic drug will be taken. It will be leads to the contraction is decreased and the spasm will be reduced, and that's why they are called as antispasmodic drugs. It's simple. Next section, what are the name of that drugs they are using as a antispasmodic drugs? We can see here first one, glycopyrrolate, dicyclomine or the escapolamine, they are also called as hyoscine. These are the three drugs, glycopyrrolate, dicyclomine or the escapolamine. They are the three drugs which are going to introduced in the patient is having any, we can say like this, the patient will get hypercontraction in what, in the GIT, or the hypercontraction in what, in the uterus. It will be reduces, all the contraction will be reduces by them, so they are acting as an antispasmodic drug of groups. In next section we are going to see about the what are the main drug effect here. In the 2 or 3 drugs we can see here. First, escapolamine. What are the other usage of escapolamine? Also one use we can see here, we can use in the antispasmodic effect if the patient is having any contraction in our GIT or the uterus. Second action, they are acting as an anti-emetic drug. Emetic means basically vomiting. They prevent the vomiting. In the case of drug of choice, they preventing vomiting in the motion sickness. If any patient having motion sickness is happened, these drugs will be taken as an anti-emetic agent in the motion sickness, and they are basically present in the transdermal patches. Their patches will become, these patches will be taken on the skins, so they are the transdermal patches will present available for the available in the market. How they are applied on the body? This transdermal patch of the scopolamine, if the patient suffer from the motion sickness, suppose that we're traveling somewhere in the bus or the train, like different, so we apply 4 to 5 hours before the journey, and their effect will be maximum for, we can say like this, 2 to 3 days. So every 2 to 3 days we have to take, if we are traveler, so we have to take it. If the patient suffer from, if that person suffer from the motion sickness, or any patient suffer from the motion sickness. Next we are going to see what are the anticholinergic drugs acting on our bladder. In bladder, basically you know, there is a detrusor muscles of the bladder. In the parasympathetic activity, they are going to be contracted, but trigone and the sphincter will be gets relaxed. So these drugs, anti-muscarinic drug, is going to be action which decreases the detrusor muscle contraction. What is the main function of it? They are going to contracted. It means here it gets relaxed of the detrusor muscle. So if any patient is having hyperactivity of the detrusor muscle, what does it mean? You can understand now. If there is a small quantity of urine is available in our bladder, if there is only single or the small amount of urine is available in our bladder, it leads to frequent urge of urination is occur here. The frequent urge of urination is because of detrusor muscle is constricted or the contracted frequently. So we have to prevent this frequent contraction of the bladder, for which we are going to take anticholinergic drugs in the bladder section. We can see here, suppose that this is the bladder, and we can see here trigone, that these detrusor muscles are gets relaxed, and their relaxation is hyperactive. It's happened very fastly, or at a time, many times it's happened after the 10 to 20 minutes, or the frequently the urge of urination is occur because there is a less quantity of urine is present inside it. If there is any less quantity of urine is present in it, there are urge of urination will be happening in the patient, and patients are feeling more bad for it. Because why? Because they feeling urge to urination very quickly. Next we can see in this section the overactive bladder or the detrusor instability, because the detrusor muscles are not stable, they are working very fast, or the overactive. So the detrusor instability is gets contracted, they leads to a spontaneous contraction of the bladder. So we are going to see there is a urge of incontinence, or we can say like this, the patient is not feeling good at that time, all time they are in toilet. So what are the drugs we are going to see here for them? There is 2 types of drug. Some of the drugs are acting selectively action, and some of them are non-selective. Non-selective means they are acting more than one receptor basically, and selective drugs are acting on the specific receptors. They are targeting the only M1, it means M1, M2, it means M2. So they are the selective drugs. Some of them selective and some of them non-selective. What drugs? Anti-muscarinic we are discussing here. You have to memorize it. And these are the anti-muscarinic selective and anti-muscarinic non-selective. What are the selective anti-muscarinic drugs? They are acting on the M3 receptor only. We can see here they are acting on the M3 receptor basically. And this M3 receptor is having two drugs, darifenacin and solifenacin. These are the two drugs which are the selective anti-muscarinic drug. Their action is preventing the urge of incontinence if the patient is having hypermotility or the hypercontractility of the bladder, the tricep muscles will be. Next point we can see, there is a non-selective. They are acting on M1 receptor, they are acting on M2 receptor, they are acting on the M3 receptors. They are blocking all the M1, M2, M3 receptors. These drugs are, that's why these drugs are non-selective. They are acting anywhere. So what are the name of that drugs? We can see flavocet, and we can see physoteridine, oxybutynin, toltridine, and the Prosperium. These are the 5 drugs. We have to memorize it from there. These are the non-selective anti-muscarinic drugs. Next point we can see darifenacin. Darifenacin is selective or non-selective? It is the selective drug, and they are blocking basically M3. So these drugs are drug of choice in the case of urge incontinence if the patient is having. Next one, oxybutynin. They are very toxic drugs, so we are not going to take it, and they are available in transdermal patches. So these are very toxic drugs. We are not going to prefer to take these drugs. Next one is Prosperium. Prosperium is the drug. They are the quaternary amines. They are crossing blood-brain barrier. Yes, these are the quaternary amines. It means they are the lipid insoluble. It means these drugs are acting peripherally. So these drugs are not going to cross the blood-brain barrier. So these drugs are also good for us. So Prosperium, oxybutynin, darifenacin. These are the important drugs from here. And these are the non-selective and selective drugs. And about the anti-muscarinic, anticholinergic drugs. This is all about the anticholinergic drugs, and here is the end of our first part. That is anticholinergic drugs, about it, and about the sympatho, or we can say like this. Now in the next topic we are going to discuss about the sympathomimetic drug or sympatholytic drugs. In parasympathetic, same. The parasympathomimetic drug is agonist, but parasympatholytic drug are the antagonist. Or we can say like this, they are also acting as a cholinoblockers or the anti-muscarinic receptors or the anti-muscarinic drugs. So in next section we are going to see about the sympathetic, or maybe we come up with a small lecture about the bladder and eyes. So see you in next video. Thank you. Let's continue our study with R.K Medicos. Thank you. Bye bye.